patients have a hip replacement, there are different ways of doing the surgery. Unlike knee replacements, where generally speaking the surgery comes right through the front of the knee and then kind of sneaks around the kneecap, with the hip replacement it's a ball and a socket. And so the goal of the surgery is to remove the worn out ball and socket and replace it with parts. Because of the way the anatomy is, you can access this area of worn out hip through either the side or the front of your body. When you come by the side, it's often called a posterior approach because it means it goes behind the big muscle which helps you control your hip, the abductor muscle. That's the posterior approach to the hip. The anterior approach to the hip makes the same type of surgery, but it's done in front of this muscle. The risks and benefits of these vary. With the posterior approach, it requires making a window behind the muscle to get access to the ball, and that window needs to be repaired. Traditionally, this made an increased risk to patients that the ball could pop out of the socket, but with modern techniques, the risk for dislocation of the hip has become much, much less and is very rare now. The anterior approach does not have this issue of having to make a window, but it does require special equipment to get appropriate visualization to put the implants where they belong. In my opinion, this is similar to walking through the front door of the house or the side door of your house. It doesn't really matter which door you walk through as long as you know which door you're walking through and you can see what you're doing when you're walking through the door. At the Center for Hip and Knee Replacement, we offer both options for the anterior and posterior approach, and this is something that could be discussed with each patient and surgeon as to which approach would probably be better potentially for them. But in general, the approach does not affect the outcome as much as making sure the implants are placed in the right place. One of the technologies we use for this is the Mako robotic arm-assisted surgery. With this technology, it allows us to plan the implant position before we do the surgery using a scan of the patient's hip. And then once the implant is planned, it doesn't matter with the robotic technology whether the approach is from the anterior or posterior direction. Once the machine knows where the patient is in space, it will help the surgeon place the implant right where it belongs. So the decision for an anterior and posterior approach, in my opinion, is really based on each patient's specific interests and anatomical needs. Some patients will just be better for a posterior approach, and some are just better for an anterior approach, depending on where their arthritis is and how they're shaped as a person. I do not believe there is a big difference in the recovery between these two approaches, although many patients feel and have heard that the anterior approach is better. It's a discussion that will be carried out between myself or one of my colleagues and the patient to make the decision. I do believe the Mako robotic arm-assisted surgery is helping us to put these implants in a less invasive way, and so I will utilize that technology regardless of the approach, as long as I feel it is safe for that particular patient.